Hello class, for our final project we decided to do a community health intervention for childhood asthma. This presentation will be presented by Summer Jordan, Ana Gabriela Lopez, Ana Julia Santa Elena, and Nayeli Ortega. Our target community was an urban neighborhood in Bronx, New York. The population of this neighborhood consists of both Hispanic and Latino and African American residents. New York City Department of Health and Mental Hygiene South Bronx has the highest rate of childhood asthma hospitalizations. Partnering with local schools, community centers, and other organizations can get the community to engage and participate in the childhood asthma interventions. Engaging schools in the community can be an effective way to reach children and their families with asthma education and other helpful resources for asthma management. Some strategies to include schools to engage in the community for preventing childhood asthma are reaching out to school administrations, partnering with school nurses, health educators, and other health professionals to plan and implement asthma education and awareness. Schools can provide training and resources to school staff on asthma management. Partnering with community centers, they can offer educational programs, provide asthma screenings, and host support groups. To gather information about cultural factors that impact community engagement and participation, a survey would be conducted and analyzed on which factors are preventing community engagement. Some cultural factors include language barriers, distrust of medical professionals, transportation issues. Key community members and partners to include for this intervention would be community leaders, parents, family members, healthcare providers, and local organizations. The short-term goals of this intervention are to increase awareness of childhood asthma and its triggers within the community by distributing educational materials such as brochures and flyers within 6 months. Flyers will be available in appropriate language to accommodate the community. Ensuring that every child who is diagnosed with asthma is in the community has an action plan to manage their asthma within 3 months. Another short-term goal is to increase the number of healthcare providers in the community who receive training on asthma management within 6 months. Medium-term goals consist of reducing the number of childhood asthma hospitalizations by 25% within 2 years, increase asthma awareness and education about childhood asthma. This can include developing more educational materials about asthma triggers, asthma symptoms, and asthma management. Providing training to healthcare providers, school staff, and community members within 1 year. Educational materials will be distributed via mailers and will be available at local clinics and community centers. Another medium-term goal is increasing access to healthcare and medication for children with asthma. This can include partnering up with local healthcare providers to offer asthma screenings, developing referral systems to connect children with asthma. Some long-term goals for this intervention include creating a local committee dedicated to monitoring childhood asthma, implementing initiatives to help control and reduce childhood asthma. This committee will be formed and active within 2 to 3 months. Once the committee is established, they will be active permanently in the community. Another long-term goal is getting state and private funding to help with resources. Getting state and private funding will have financial stability for continued growth of the committee, will provide seed money within 3 months after committee has been established, and set new financial targets at the end of quarter 4 and begin the new quarter with a new financial strategy. Another long-term goal is creating a sustainable framework for community-level childhood asthma resources and interventions. Establishing local relationships with local businesses, health authorities, schools, and other worship organizations. Also, creating outreach programs for parents of children with asthma. The intervention strategy is the implementation of a community-based asthma management program. This program will involve education that will consist of multiple asthma education sessions for parents, caregivers, and children. This education will also provide information and resources on asthma management, trigger avoidance, and medication adherence. The program will also involve medication management, involve working with healthcare providers to ensure that children have access to appropriate medications and that the regimens are being followed correctly. It would also include environmental remediation. This will be conducted in homes and community settings to reduce exposure to asthma triggers. Intervention targets. The targets for this intervention are children with asthma and their families living in Bronx, New York City. The rest of the community members, healthcare providers, and other local organizations are also targets for this intervention. The intervention will be tailored to the specific needs of the children and families in Bronx, New York, working closely with community organizations and representatives to identify the most significant environmental triggers of asthma in that area. This will also be designed to be culturally and linguistically appropriate with materials and education sessions that will be provided in multiple languages. The promotion of this intervention will be via community-wide marketing campaign, financial resources being utilized to gaining awareness and community stakeholders' involvement. Marketing tactics will include posters at bus stops, mailers, billboards, and social media campaigns. Community members will engage in community outreach by having booths set up at local community events. The targets for this intervention will depend on the venue and method of outreach. Targets for traction will be set and adjusted accordingly. For example, if PTA meetings have about 50 people there, the target will be to get about 30 attendees to join the Childhood Asthma Committee. For committee members hosting tables at events and at local storefronts, the goals will be to bring awareness about the issue of childhood asthma in Bronx, New York. The participation, the benefit of mailers, billboards, and posters is that it will create exposure and awareness of the childhood asthma issue and efforts for intervention and prevention. Social media campaigns can have captions that end with a question to encourage people to comment and engage. Info tables can be gamified by having activities where people can guess asthma statistics for the South Bronx neighborhood. The individuals and community representatives of this intervention consist of the Bronx Mayor, which is Ruben Diaz, City Council Member representing South Bronx, Rafael Salamanca Jr. Some organizations can be New York City Council committees, education, parks and recreation, public housing, housing and buildings, hospitals and clinics, which can include New York City Health Plus Hospital, Hospital de Mami, Montefiore, AFC Urgent Care Bronx 149th, and Casa Maria Community Health Center. The intervention will benefit local, city, county, state, and federal partners by effectively targeting and mitigating an important community health issue. Local and city partners will benefit by having a healthier community and an informed community on the issue of childhood asthma. The intervention's efficacy will be measured by the number of children diagnosed with asthma and their quality of life before and after the intervention. Quality of life for this particular intervention will be measured by number of asthma attacks, severity of the attacks, which would consist of mild, moderate, or severe, if attacks could be managed with traditional prescribed medication, or if a visit to the hospital was required, number of days of school missed due to an asthma attack, number of days a parent missed work due to their child having an asthma attack, and financial impact of school and or work missed due to an asthma attack. The objective is to have improvements in each of these quality of life criteria. Fewer asthma attacks, lessened severity, can easily be managed with prescribed medications, little to no missed days of school or work, and improved financial stability. County, state, and national statistics for childhood asthma will be used as benchmarks for the efficacy of the intervention. The timeliness will be based on a quarterly basis. Every 3 months, metrics will be assessed for changes and improvements. And that concludes our presentation. Thank you.